Hey, ReMar nurses, guess what? You can, you will, you must pass NCLEX. I'm here today with a live broadcast. I like to call this Winning Wednesdays, and I promised you guys I would do it if we reached our share goal, which we did. Thank you so much for always sharing this video, all the others. We reached our 100 shares, and so I am here. We are going to talk about therapeutic relationships. And this really is a foundational point that goes along with your therapeutic communications lecture in your virtual trainer workbook. So I am hitting you guys with a power study session. I know you're going to enjoy this information. I am going to be giving you my notes specifically, but guess what? I also put my notes in the virtual trainer file vault so you can listen along and print those out at your convenience. Yes. So shout out to all of the ReMar nurses. We have almost 8,000 nurses in the virtual trainer. I saw the testimonials. I'm so excited to you guys who are passing NCLEX. Got 2 today. It was really, really nice to read. ReMarNurse.com is where you can find me and all of my NCLEX preparation material, 100% content. And again, we are going over therapeutic communications. Check it out. My notes are in your file vault. So get out your pen and paper and let's go. Let's go, guys. Now, when you talk about therapeutic relationships, this is a central component to providing effective care, specifically to psychiatric nursing. I mean, you want to build a therapeutic relationship in all of your nurse-client interactions, but for psych, they are essentially important because what? Because psychiatric patients, and don't worry, I'm going to go back to it, psychiatric patients have to be able not only to deal with the alteration in their reality, but to accept new information from an individual who they believe to be helping them. So when you have a patient and say you're in med surg and you give them Tylenol, when you give them acetaminophen, I should say, that med surg patient more than likely is going to take it. They're going to understand you're a nurse and they're going to take the treatment. If you're dealing with a client who needs psychiatric care, perhaps they have paranoid delusions or they have a schizophrenia, then you could give them acetaminophen, but will they take it as willingly? Will they trust you? You know, and so this is why developing therapeutic relationships and using therapeutic communication is so important. So the components of the therapeutic relationship are going to be trust, genuine interest, empathy, acceptance, and positive regard. And these are things that the nurse is demonstrating to the client. These are things that the nurse is demonstrating to the client. Now, welcome everybody here. Therapeutic relationships are different. They are different and they are unique. Let's review the 2 other types of relationships. There's 3 altogether when you talk about psychiatric nursing. And so the first one is a social relationship. And social relationships are one that we hold very commonly. They are used primarily for friendship, for, of course, socialization, for companionship, or accomplishing a task. For example, our Facebook group, we have a ReMar Nurse Facebook group. It's a social group. You guys are all in there to accomplish your task, and that is to pass NCLEX. So the communication may be quite superficial, right? If you're in there, you're just like, what's up, everybody? I need help with this question, you know, or hey, I'm a little bit afraid. Somebody pray for me. All right. And so the roles in a social relationship often change. Often one person is the educator and the other person is receiving the education, or you guys are both encouraging each other back and forth, but they change. Okay. Now let's look at the intimate relationship. An intimate relationship is where you have an emotional commitment by both parties to each other. And there is an expectation that your needs are going to be met in this intimate relationship. It is not superficial, it is quite deep, and you place expectations on the other person. So you have your social relationships, and just think to yourself, okay, in my life, who am I social with? Who do I have these relationships with where sometimes it's superficial, or sometimes I'm just trying to get something done? If it's somebody in your church or maybe a classmate, that's a social relationship. But intimate relationship is somebody who you are emotionally connected to. You rely on that person for support. You expect to have your needs met emotionally by that person, and you also seek to meet the needs of the other person in the party. So these are relationships that nurses do not have with their psychiatric clients ever. Okay. What we are seeking to have is the therapeutic relationship. And so when you're taking your NCLEX exam, you have to be very careful that you don't demonstrate behavior that falls into a social category or an intimate category. So I'm about to show you my slide for the therapeutic relationship and aspects of that. All right. So the therapeutic relationship, right, it focuses on the needs, the feelings, and the ideas of the client only. All right. So the main focus of that relationship is the client. The nurse always agrees with the client. What do they want to work on? What do they want to work on? Okay. So this is a very uneven professional relationship, but this is what NCLEX wants us to strive to get. So I asked you guys this question: does the nurse care about whether the client likes her, okay, or him? Should the nurse care about whether the client is happy with them? What do you guys think about that? Let me ask you another question. Does the nurse care about whether the client is grateful? Is the client grateful for this interaction? What do you guys think? What do you guys think? And this is, these are certain aspects of the therapeutic relationship. Okay. Yes, I see the answers rolling in. Good job, guys. This is what you're doing. We're studying. This is a power study session. It's not Monday. It's Winning Wednesday. Come on in. This is what I like to see. You guys making an effort to review this information. All right. This is the benefit of the ReMar family. We study together. And a lot of you guys are answering yes. Some of you answering no. Here is the correct response. What I'm looking for is when we talk about whether the nurse cares about if the client likes her, that is going to be a no. Okay. I don't care if a client likes me personally as a nurse. It's not a social relationship. Okay. It's not an intimate relationship. My concern is, am I going to help you meet your medical goals? Okay. So I'm also not looking for the client to be grateful. You guys are not going to look for your patients to be grateful. You know, in nursing, you do not get a lot of pats on the backs. You don't get stickers. You don't get cookies. You don't get anything like that. Okay. So we're not looking for a reciprocal relationship from the client. All right. So be careful with that. All right. We got to take our personal feelings out of it. Yes. I love what you said, Tam. You're there to do a job. You're there to do a job. And so this is what the therapeutic relationship looks like. It's very different from the social or the intimate relationship. All right, we have to understand that. Now let's go on. Let's go on to my next slide, which is this. When you talk about the therapeutic relationship, there are 3 phases of that relationship that take place if it's done correctly. And that is going to be starting with an orientation period. And then second, you're going to go into your working process with the client, and then the termination. And these are things that you want to know. This is fundamental nursing. All right. And so I'm going to bring you the aspects of it just in case you forgot it from class. So for the orientation period, let's talk about that. The orientation phase, it begins when the nurse and the client meet. And that makes sense because it sounds like it. In orientation, you figure out who is who. And so the nurse has a responsibility, and the client also will demonstrate certain behavior. You guys don't necessarily have to know. I really do not want you to spend a ton of time on this. I want you to definitely know the 3 phases and kind of the specific elements. So check out my notes in the virtual trainer for that information. So the nurse, during the orientation phase, she explains the role. Okay, so that sounds like, hi, I'm your nurse. I am going to be here working with you. And we are going to work on helping you. She'll say something like, I am going to help you to work through your history of, medication non-compliance, right? We're going to talk about it. We're going to help to see if we can improve your medication compliance, because that's what nurses do, right? So they're establishing the role, right? Also, the nurse is gathering data. She's gathering data about that client. And most importantly, what the nurse does during the orientation phase, I should have put this in a bold print, is establishing a termination date. That is the first thing that you need to tell your client about this therapeutic relationship. You tell them, I am here for 4 weeks to be working with you. I am here for 7 days. It is so important because, again, in social relationships, you don't do that. You don't say, we're going to be cool until this semester is over with, and then when I change classes, I'm never going to talk to you again, right? We don't do that for social relationships, and we don't do it for intimate relationships at all, but you definitely need to do it for this therapeutic relationship, okay? All right, and so the client is going to be asking questions as well, and also seeking the assistance of the nurse. All right, seeking the assistance of the nurse. All right. Okay, let's go on to the working phase, but I have to shout out to Shar. She says, OMG, Regina, I passed my NCLEX PN March 20th. The VT and quick facts are lifesavers. I pray that God continue to bless you, Mark, and the whole ReMar team. Thank you. Thank you. Thank you so much for coming back and letting us all know that you passed, you got those letters. That is what this is all about. I am praying that somebody watching this will be next up to get their license. So incredible, amazing, so happy for you. Yes. All right, we are digging in, guys. We want to get our nursing license too. Let's talk about the working phase of a therapeutic relationship. And what happens here is the client identifies issues or concerns. Yep. Take note of that. You see what I said? I said the client is going to be identifying issues or concerns, and the nurse is there to provide unconditional acceptance, because things get ugly during the working phase of a nurse-client relationship. Things get super ugly. All right. And the nurse is also going to be providing information to the client. And during this time, as the client is identifying their problems, they may have some exploitive behaviors. And that means that during this time, the client may struggle. They may struggle in the new relationship. They may go back and forth about whether this is a good idea or not. They may try to test the limits of the nurse. So if the nurse comes in, the client stands up and wraps their arms around the nurse for a big hug, right? The client may try to hold hands with the nurse. They're really trying to see exactly, is this just a therapeutic relationship, or how far can I take this? So this is what you see during the working phase of a client-nurse relationship. Particularly, again, we're talking about psychiatric care here. All right. So this is considered the working phase, the second phase. And so the final phase is called the termination phase. Come on in, guys. We are studying, and then I just have a couple of review questions for you here at the end. The termination phase is where you want to reach. It's where you want to get to. It is a goal, right? Because the client has their problems resolved, and it is time for this relationship to end. But remember, it's not a surprise, because we talked about the relationship ending in what phase? In the orientation phase. Yes. So in the termination phase, the nurse is wrapping it up. She's teaching those preventative measures. Okay. We're going to make sure you don't get in the situation again. You're going to take care of yourself. She's teaching self-care, and she terminates the relationship, right? And she terminates the relationship. So a scenario that I can think of is after, and this is not psychiatric care, but this may show you what it looks like, right? So if you have a baby in the hospital, before you leave, they give you what? What do they give you about the baby and about yourself? The nurse comes in and she gives you discharge instructions, right? This is the nurse terminating the relationship. So she says, okay, this is your baby. This is how you provide cord care. This is how you're going to feed it. Don't bathe it too much. Keep it warm for yourself. Do this. You know, she tells you all these things. And then she says, are there any questions left? And then after that, the relationship is terminated. That means you don't have any more expectations from that nurse to provide care for you or the baby. It's yours now, right? And so this is what the termination phase looks like. And so for the client, it is up to them to abandon their old needs, right? So you can't come in with the same kind of needs, because now you have already demonstrated and been educated on how to provide care for yourself to become independent. Yes, to become independent. And so you have a positive view, and this is the best case scenario for a client who has gone through a therapeutic relationship with the nurse. Okay, does everybody get that? So this was a time we took about 20 minutes to go over nurse therapeutic relationship, right? And you guys now know what is needed to have one, how it is different from a social and intimate relationship, and then also the 3 phases. So I think I can hit you with some questions now. So let's try these questions. Do your best. All right, just do your best and prepare to critically think. All right. Question number 1. Here we go. A nurse is developing a therapeutic relationship with a client. She calls the client by her preferred name during the interaction. This demonstrates which of the following? Okay. Is it trust, genuine interest, positive self-regard, or transference? Ooh. All right. If you have the VT, you might want to take a look at my notes in the file vault. All right. Okay. Let me read it again. A nurse is developing a therapeutic relationship with a client. She calls the client by her preferred name during the interaction. This demonstrates which of the following? 1, is it trust? 2, genuine interest. 3, positive self-regard. Or 4, transference. I see the answers rolling in. And the correct answer is going to be, it's 3. It's positive self-regard. Positive self-regard. And if you guys print out my notes, at the page number 3, because there's 3 pages of notes, I go over some key terms. I go over the key terms. And so positive self-regard is, these are actions that convey respect. And so when the nurse calls the client by their name, spends time with the client, this is considered a positive self-regard. Positive self-regard. Okay, let's do question number 2. It says this. Oh, that's not right. One second. Let me go to this one right here. Question number 2. The registered nurse is developing a therapeutic relationship. Which of the following is the most appropriate action? I'll read it again. The registered nurse is developing a therapeutic relationship. Which of the following is the most appropriate action? Is it number 1, the nurse should avoid judging the actions of the client? 2, the nurse should avoid setting boundaries. 3, the nurse give advice to meet the client's needs. Or 4, the nurse should accept inappropriate behavior due to illness. All right. So which one? I'll read it again. The registered nurse is developing a therapeutic relationship. Which of the following is the most appropriate action? Which of the following is the most appropriate action? Is it number 1, the nurse should avoid judging the actions of the client? 2, the nurse should avoid setting boundaries. 3, the nurse should give advice to meet the client's needs. Or 4, the nurse should accept inappropriate behavior due to illness. Oh my goodness, this is good. This is good, guys. Come on in. We are studying. I see you, Facebook. Share this video. If we get to 100 shares, I'll do another one. I'll come back on and do another lecture. YouTube, you made it. Your goal, 100 thumbs up on this video. We'll come back again. All right. The correct answer for question number 2, thank you for participating. It is indeed number 1. The nurse should avoid judging the actions of the client. Oh my goodness, this is so important in psychiatric nursing. We do not judge the client or their actions. Okay, so the answer item says the nurse should avoid judging. That is the most appropriate action. Did you get that right? Did you get that right? Let's look at the other ones in case you chose something else. Number 2 says the nurse should avoid setting boundaries. Do we need to avoid doing that, or is it necessary to set boundaries? It is necessary. It is so necessary to set boundaries. So we won't be avoiding that. All right. 3, never give advice. You guys are so right. The nurse give advice to meet the client's needs. Giving advice is a no-no. Anytime you see giving advice, giving your opinion in psychiatric care, don't pick it. Don't pick it. It's not going to be right. It's not going to be right. All right. So we're never going to give advice. And then 4, we do not accept inappropriate behavior. We don't accept it. Now, we don't judge the client. You know, we don't judge the client, but we don't have to accept inappropriate behavior because we are setting boundaries. We are setting boundaries, okay? Great job, guys. Great job. Let's try another one here. Let's see if you can do this one. It says this: a nurse is holding weekly counseling sessions with a client. The client presents with multiple changes in appearance. The client also has rapid shifts in behavior while identifying problems. The nurse-client phase is which of the following? Is it 1, orientation, 2, working, 3, plateau, or 4, termination? And so we're talking about weekly counseling sessions. The client presents with multiple changes in appearance. The client also has rapid shifts in behavior while identifying problems. The nurse-client phase is which of the following? All right, orientation, working, plateau, or termination. What did you guys learn today? Come on, let's demonstrate it. Absolutely. I'm so glad you came to today's study session because you know that it is POW, number 2, working, right? And so during the working phase, the nurse is helping to work through feelings and problems with the client. So it is very common for clients to come and their appearance may change, right? Because they're trying to prepare for this new relationship. So they have these different hairstyles, different dresses. Sometimes their behavior may shift where they're very happy to they're very sad. And so as a client is working through trauma or mental illness, you will see changes in the way they behave. All right. But at the end, it should all lead to a positive result. So, hey, congratulations, guys. You did the study session. And again, you can find all of my notes and even more in your virtual trainer. So just open your virtual trainer account. Okay, go to the file vault. You guys know the file vault icon. That's where I upload new NCLEX information for you. And so when you open the file vault, go ahead. You will see the folders that I have for you before the books arrive, answer key, the event downloads and workbooks. Go ahead and skip that. Skip the NCLEX calendar and go to new NCLEX lecture information. And there is where you will find my notes for today. And again, like I said, it's 3 pages. 2 pages are talking about a therapeutic relationship, going over the differences between social and intimate. And then what I did was I went into the 3 phases of the therapeutic relationship and kind of gave you some actions of the nurse and the client. And then the final page is key terms. So I give you the definitions of important terms that you need to know. So this is in the new NCLEX lecture folder. All right. And also, hey, if you have not gotten your VT, it's okay. We still have the Stimulate Your NCLEX sale going on right now. So it's not too late for you to jump in, get all this good information and pass your NCLEX. All right. And the way you do it is just head over to ReMarNurse.com, ReMarNurse.com, and you're going to see that the VT price, $369. Guess what? We took $180 off of that price. So you will have a lovely discount right there waiting for you. So jump in. This is a great time to do it. I have some amazing resources I will be adding to the virtual trainer. I can't even tell you guys, but we're going to do some awesome things. So jump in the virtual trainer and get started today. Okay. Anything else about the virtual trainer? If your NCLEX is in a few weeks, don't even worry. Okay. If you have the VT, we're going to work on not only your content, but I also will be doing some test anxiety for my students in the virtual trainer. We're going to work on that test anxiety. All right. So you definitely have gotten this. All right. Tiffany tests tomorrow. We will be praying for you. And I am very, very proud of you. I'm very proud of you for getting this far. Hey, to all my nursing students who are watching, I'm so happy that you're here too. I am looking forward to studying with you more and more and more. So every time that I come on live, if you guys click the notification buttons, you will know when I'm coming on live and doing a class for you. Don't forget to share this video. All right. If we get 100 shares on Facebook, I will absolutely come back and go over the second part of therapeutic relationships, which is therapeutic communication. Therapeutic communication. And boy, is that a topic that has some tricks and some ways to remember it. It's a great topic. I love talking about therapeutic communication. So share this video, like this video. Indeed, it was an excellent session. It was an excellent session. Okay, Ben says, Regina, I just failed for the 5th time. I need advice. I want to have a study plan. I'm so sad right now. I took it yesterday. All right. You know what, Ben? I just want to say this. You said you took the NCLEX yesterday and you failed it, but today you showed up and you studied here. And so that is amazing. And that lets me know that even through your sadness, your character and your strength is coming through. And so that means that you have a great foundation to build on. All right. So we are just going to get back up on the horse again. Then you are going to take this test again. You're going to prepare for it because honestly, there are people that have failed the NCLEX many more times. All right. 10 times, 11 times, and we have helped them to pass. So I am not discouraged. All right. I'm not discouraged by your past. I am hopeful for your future, So if you don't have the virtual trainer, please get into it. All right. It's easy. This is a great time to have it. And in the virtual trainer file vault, let me see if I can go here. In the virtual trainer file vault, you will have a study plan laid out for you. Okay. So I don't know, get into the VT if you don't have it and go to that NCLEX calendar. All right. NCLEX calendar and resources. And the calendar is there to help you get through the information. Having a study plan does indeed help. It does indeed help because it helps you to stay consistent. And I don't know what could have happened, and I'm speculating, but maybe you really did know a lot of information, but maybe there were gaps in your knowledge and there were some things that you didn't know so well. So if you are more consistent studying this time, right? If you're more consistent, if you come in and pop up for the quick study sessions and you stay focused to the content and also you're able to critically think, I do believe you can pass. I do. I'm not discouraged again. Like I said, I think it's just a matter of trying again. You know, a test does not, let me say this, a test does not mean that, or I should say it like this for you, failing a test does not mean that you are not going to be a great nurse or that you will never get your license. When you fail a test, all it means is that on a specific date with a set of specific questions, you did not reach a specific goal. Now, if you take that test another day or you get presented with different questions, you very well can pass the NCLEX exam. All right. So I don't want us to make our performance on the NCLEX be a forever predictor of how we're going to do, because it's not. It's just a test on one day. All right. Okay. So I appreciate the encouragement that I see from the community. You're not alone in the way you feel right now, but definitely we are hoping and we are praying for you. All right. Okay. On average, how long does it take to complete the virtual trainer? I scheduled my NCLEX for April 14th. Okay, so in the virtual trainer, because you get immediate access and you essentially can go by your own pace, it can take you as long or as little as you like. But on average, my program is 6 weeks. But from what I see, because I include a lot of break time and rest time, if students amend it by adding one more study day, they can actually do the program in about 4 weeks. Okay, but we have had students who have done it in 2 weeks. So let me not put limitations on your ability. Okay. So which of your books is good for nursing students? Okay. For nursing students, I think nursing students should definitely have my quick facts for NCLEX, which is it's in my study pile, so I don't have it, but it is the 5-star quick facts. Oh my goodness. Do you have one by? We'll get you one. I'll show one in 1 second here. But the quick facts for NCLEX is going to be the best resource for nursing students. And it's just the 5-star version. And what it contains is content that you can pop open in your classes. All right, in your classes. So let me see. Other questions? So somebody said they did theirs in 17 days. Okay, well, there you go. All right. So this is the quick facts for NCLEX. This is my actual book. And so there are there's writings all in it, but this is what it looks like. This is what it looks like. Quick facts for NCLEX, and it is the 5-star version. Okay, the 5-star version. If you're a repeat test taker, I know you guys see me holding up quick facts and you're like, yes, that's the ticket. But just this book alone, I do not feel is enough to pass NCLEX. I honestly think for repeat test takers, you need the entire program, and that includes the lectures and the questions, okay? Not just the book, because this is just a book, okay? So if you need topics that are not in this book, but that are in here, you still have to find a way to get them. So with the opportunity for the stimulus sale and the $180 off, cover your bases. Really invest in this as you would something else. If you get a car or if you get, any other thing, you're not looking and saying, well, I guess I'll get the car that doesn't have the complete set of tires because I just want to get here from here, or I only want to pay a certain price. Like, your nursing license is the equivalent of 20 cars. Because once you get your nursing license, you will be able to buy car after car after car, right? Your nursing license is a huge investment. So don't try to nickel and dime it to try to get by with the least, all right? Because actually, if you keep failing NCLEX, it costs a lot more than just preparing for it the right way up front, okay? That's what I have to say about that. All right. Okay, guys. That's it. I think that's it. Congratulations. Okay. I do hope that you guys all are going to get your license and become ReMar nurses. I see that. Okay. All right, you all. So if we get the shares, if we get the thumbs up, so I'm looking for 100 shares on Facebook and then 100 thumbs up on the YouTube video, I will definitely come back with therapeutic communications. If not, you guys will see me on Monday, again, where I go live every Monday for how to pass NCLEX and your Monday motivation. So remember, guys, I always say this. You say it with me too. You can, you will, you must pass NCLEX. Congratulations, Maya, for passing NCLEX. I am super proud of you and all of you out there. Thanks for watching. Bye-bye.